Hi, this is Keel McDonald, just presenting my working diagnosis and my differential diagnosis for the GI case study. So to start with, I have acute pancreatitis as my working diagnosis. I would label it late stage, but that is seen through the development of colon sign due to the bleeding in the retroperitoneal space, which does take time to develop, hours, could be days. So that's why I'm saying late stage. And the patient has been complaining of 3 out of 10 pain for the last week. But determined through the assessment and the correlating symptoms and reading through the case study, the patient complains of 3 out of 10 pain in the left upper quadrant, epigastric, and right upper quadrant regions in the abdomen. So right there where the pancreatitis is. Right where the pancreatitis is, sorry. Other signs are nausea and vomiting. Typically nauseated after eating, the patient states. And that is one of the reasons the patient has been trying not to eat, because pain worsens and he becomes nauseated with this, which are both symptoms of this disease. So yes, he has a decreased appetite, the nausea, vomiting. And in this case, we don't exactly see a fever, but he also has taken 2 Tylenol extra strength. So that could be hiding and muting the temperature that we would see. But he does have clammy skin. Patient has described feeling dizzy and nauseous. So that is part of the fever. But in this case, it's not seen, as well as tachycardia is not seen, which is typically a symptom. We're not seeing it here. He has a heart rate of 85, I think. So it's not exactly tachycardia, but all the other signs and symptoms are pointing to it, and through pertinent negatives that we find through our other assessments and specialty tests that we do. Colon sign is is one of the big ones. There is no Gray Turner signs that you would find lateral, but he does have colon sign, which does take time to develop, which leads me to believe it is later stage and quite severe if he is getting that pooling of blood in the umbilicus. So yes, that is important to take into fact, and it's one of the big signs that we can actually say that this is most likely pancreatitis. But yeah, there are no, as far as life-threatening diseases, there are no pulsating masses seen upon abdomen, and his blood pressure is actually it's quite wide actually. It's 150 over 100, so that's not very indicative of major bleeding or major hemorrhage in the abdomen. But we do know that there is some because of that colon sign. But that's minimal, but it is to take into factor. And then with the pain, you want to factor in liver, any liver diseases. There's no jaundice, cystis indicating that. Some of the signs and symptoms correlate, but with the colon sign, you wouldn't exactly see that in liver disease. And if you did a liver span test like I did in my assessment, you would see that there is no inflame or enlargement of the liver, or none done on that test. You can't rule it out for sure, but it's kind of be able to push that on the backbone and rule out for now any liver diseases. And there was no rebound tenderness that leads me to believe that there is peritonitis or major bleeding into the abdomen. I know that there is a colon sign, but there's no crazy rebound tenderness found, or patient has a state of any pain upon it. And then correlating this to his past medical history, the change of pain from 3 out of 10 to 9 out of 10, and the colon sign just indicates it is most likely later stage, and that helps us make this assessment. And then the use of ETOH a few times a month, and having a bit of an unhealthy diet, as well as having diverticulitis. And as well as him having diverticulitis, that can lead to actually chronic pancreatitis, which could be what we're seeing here, and he's just not had it checked out, but we're most likely thinking it's an acute case because of the bleeding, because of the sudden symptoms of pain. But that diverticulitis does play into our diagnosis of this. ETOH, and this patient could be suffering from gallstones, which is why he's getting a sudden increase in pain today, which could just be the enzyme filling out and really wreaking havoc in there. But the gallstones could be why he's feeling a 9 out of 10 pain up here. But upon our specialty assessments, the Murphy sign, we don't get any major pain there. So that's my working diagnosis. And then coming down into my differential diagnosis, I have cholecystitis, an MI, and acute abdomen bleeding. So, and why I have these is increasing pain in the abdomen can be linked to any of these conditions. So, to rule out these life-threatening ones, an MI males typically present with pain localized to the chest that may radiate to the abdomen a little bit, the shoulder, the right arm. Those are typically what you would see in a male of this age, or what are most common. So because there is pain coming down to here and sharp pain, and he is a 6-year-old patient, we do want to rule that out. There's also clammy skin, nausea, vomiting, dizziness the patient complains of, which could be because of hemorrhaging, could be because of an MI, as well as shortness of breath. The patient does claim he's having some shortness of breath. So this is very indicative of an MI. Upon a 12 lead, we don't get, I believe we have a normal sinus rhythm in this patient. And I believe we have normal sinus with this patient. So we can't rule it out for sure because it could be coming or something, but we're going to push that to the back one because that's not exactly what we're thinking when we get into test and see that it's most likely pancreatitis. You wouldn't see a colon sign in an MI, and along with that pain. So that is why I have MI on there, but ruling it out for now. And then abdominal bleeding. This will cause sharp pain in the peritoneum. I know there's no rebound tenderness, but and no distension. But due to colon sign developing, it does mean that there's blood pooling in there, and this could, and as those enzymes break down that tissue, this could lead to more bleeding, and it could lead to a case of peritonitis, which is what you would want to look out for. Because blood has been pooling in there. Even though there is no rebound tenderness, it's something you want to take into fact. His blood pressures look good. It's not like he doesn't seem to be compensating too much, but we do want to be aware of this, which is why you can put it on the back burner. But you would want to keep it in mind because you'd want to keep it in mind because the patient is losing blood. There could be a tank of vitals. There could be all sorts of things, but it's on the back burner for now as a differential. And then lastly, it could be cholecystitis. There is a negative Murphy sign, but because of the pain, the symptoms are very similar with the nausea, vomiting, the fever, the decreased appetite, all that. It is very similar in the symptoms. So that is why I have it on there. Negative Murphy sign, no vomiting with green bile, which kind of rules it out, but it is it could be another cause. Sometimes you see these symptoms, sometimes you don't. So that is why I have it as a differential for now. But yeah, you'd want to be aware of a tank of vitals in this patient or loss of consciousness due to the loss of blood. Dizziness, in his case, might be thinking because of loss of blood. Somewhat widening pulse pressure is something to keep an eye on, possibly due to sepsis. Want to talk about sepsis. It is another sign. I don't have it as a for sure differential, but you want to be aware of sepsis due to the necrosity of the pancreatitis at this stage, because if he's bleeding that much and if he's having the sudden pain, it could be because his pancreatitis is eating itself so much, and it's been late stage now. So you do want to be aware of sepsis setting in, and you want to take that into account back of the truck, and just be aware of that. that's kind of relating his past medical history and his chief complaint back into my differentials. Yes, awesome. Thank you. Hi, doing my abdominal assessment here. Have our 6-year-old patient. Once we arrived on scene, we donned our PPE. Walked into the scene, we see our patient clammy a little bit, kind of grimacing, guarding his stomach a little bit. The chief complaint is abdominal pain.
Yeah.
How would you describe your pain?
It's just radiating into the back there, like right at the, it's like a 9 out of 10, worse on the right. Little bit on the left there, probably 5, 6 out of 10 over there.
And when he told us that we did a 12 lead to rule out our MI, but now for this assessment, are you okay with me lifting up your shirt, taking a look at your stomach?
Yeah, absolutely.
I might have to feel it a little bit.
Yeah.
And so when would you say this pain started?
Oh, probably about a week ago. I don't really know what triggered it or anything, but it was just, like a non-stop burning. Maybe like it might have even started a little bit over here and then moved over.
Right.
But it's just constant on the right side now.
Okay, and you would say it just came constant today?
Yeah.
And it started about a week ago?
Yeah.
And you say it's just a burning kind of pain?
Yeah, no, 100%. Yeah, seems to get a little bit worse when I'm eating.
Okay, and it radiates into your back?
It does, yeah.
Just kind of the middle of your back?
Yeah.
Okay. And I do note colon sign when I lift up the shirt, just in the umbilicus region there. Okay, so we have that. Now I'll just take a listen to your abdomen. Actually, before I do that, have you been eating regularly?
Yeah, not for the last 3 days. It's just so painful when I do, but normally I eat pretty regularly.
Right, and your stool, have you been using the washroom regularly?
Not for the past, 3 days or so.
Yeah.
I don't think so.
And have you noticed any blood in your stool or urine?
No, it was just really hard. Like it was just not,
Right, okay. And the pain gets worse with eating, is that right?
Yeah.
Okay, we're gonna take a quick listen to your abdomen here.
Okay.
So everything sounds smooth in there. We're not gonna do the full minute in each quadrant for the exam. Now I'm just gonna feel, and I'm gonna kind of palpate in different quadrants of your stomach here, just to see where the pain is worse, and then we're gonna do some specialized tests after. Is that okay?
That works for me.
Perfect. Okay, so I'm just gonna feel in here. You let me know when I push in if there's any pain.
No.
No?
No.
And what about up here?
Yeah.
Yeah?
Yeah.
Yeah, that hurts?
Yeah.
I'm just gonna do the other side just to see. There?
Yeah.
Yeah? Okay. And down here, how's that pain?
No.
No? No? Okay, so I just wanna see, I don't think it's anything with your heart or your intestines, those sound good. I wanna take a look at in some of these organs. I'm gonna do a couple specialized tests.
Sure.
So the first one I'm gonna do is I'm gonna put my fingers under your rib cage,
Okay.
and I'm gonna ask you to take a deep breath, and you let me know if you get pain on inspiration when you're breathing in or letting out, okay?
Okay.
So I'm just gonna get my fingers in there, and you take a deep breath.
No.
No,
No.
no, nothing, no, right.
No.
Okay, now I'm just gonna palpate again your stomach, and this is gonna be a test. You let me know if when I let go, there's more pain
Okay.
on the way out, and this will let me know if there's any bleeding in your stomach, any organs, anything like that.
Okay.
So I'm just gonna start down here again, in, and when I let go,
Just
No.
when you push in. Oh well. No,
Okay.
actually not down there.
up here. And
Yeah,
I
just
let
when
go.
you push in.
Not when I let go though?
No.
I'm gonna check over here. When I let go,
No.
no. And down here,
No.
No, nothing at all?
No.
Okay, so I want to say it's one of your organs up here in this upper quadrant, because that seems to be where the pain is. It's not really radiating it anywhere else, right?
No.
Okay. Another test we're going to do is liver span to see if that is inflamed or see if it's normal size, because that can tell us if it's a problem with your liver, okay? So I'm just going to start off. I'm just going to knock on your stomach here. Yeah, so that sounds good there. I'm just checking there to see if it sounds hollow, if it matches the stomach, because if I hear that it's quite firm throughout there, then I might think that there's an inflamed liver in there.
Nope, fair enough.
So those tests, I think we're good. That might have been butchered a little bit.